Hello, beautiful people. Welcome to the Impulse. This is the podcast that dives into every spectrum of life. Today, we'll be sparking conversation from every aspect of life. So, today, I will be hosting a good friend of mine. You guys already know him. He's always here. So, today, again, it's nobody else but Dr. Idu. Commonly known as Dr. Idu, but we call him Gabriel. So, he'll better introduce himself before we get into what we'll be discussing today.
All right, Sidiki, thank you for having me on. Um, I needed not to do an introduction because I've been
Yeah,
here before, but for the sake of people who are just, joining the channel, I'm Gabriel and studying medicine here in Morocco. So probably I'm done with my medical journey. I'm about to start my residency. And so Sidiki just invited me on. I think the last time I came was two podcasts away.
yeah.
And yeah, like he said, I'm a
That's
very
good
good friend
purpose.
of his,
Yeah,
and he's more or less like a brother to me now.
yeah.
So he just wanted me to hop on the podcast for certain questions, and I'm here.
Yeah, and
Yeah,
today we are glad that you're back again,
it's a
to,
pleasure.
dis-
Always
to
a pleasure to be
discuss,
here.
but we'll tell you guys what we discussed.
All right.
So, should I say that or Gabriel? You just Gabriel?
Jesus Gabriel.
Nah, because I have to, because one day I will have to get my respect too, so I'll have to say that to Gabriel. So, no
Okay.
problem. At least, before we dive into the conversation, we need to know what is the motivation again
Mhm.
behind the word lab coat. What's the motivation behind the lab coat?
All right. To be honest, so growing up, I remember telling, people, I think I've said this before, that I want to be a doctor.
Yeah,
And there was one night, this I didn't say it the last time. There was one night I was sleeping on the bed. Growing up, I normally sleep with my mother.
yeah,
Then my mother it's just like a funny way of asking your kids, what do you want to be if you grow? What do you want to be if you grow? So I told my mother, my siblings were saying they want to be nurses. So I told my mother, I want to be a doctor. And guess what? So the night when I was sleeping, I was asking myself this question, can I be a doctor? Seriously. But then this is where we are today. So the motivation behind the quote, there was actually no motivation until later my mother died. Then I realized
yeah.
that, yeah,
On sympathy.
yeah, then that's where the motivation actually started. So yeah.
Okay.
Mm.
So if medicine wouldn't have worked, was there any plan B?
Well, growing up, my village, there was one main thing we do, that's fishing, right?
Mm,
So for me, going to school was not like it was not like a job for me. It
yeah.
was like growing up. That's what you do. That's what our parents made us understood that it's school. You have to learn.
Mhm.
So it wasn't a tedious work for me. So had it been that I didn't become a doctor, I would still learn anyways.
Yeah.
Probably my grades will not be up to becoming a doctor,
Mm,
but I will find something in the government doing, probably teaching, because that was one of the things I love doing. So I would have gone to teacher training because a lot of things come to play becoming a doctor. You have your finances, you have,
yeah.
your grades. So yeah, I had the grades. The finances came with scholarship. So yeah,
Yeah.
then yeah.
And one thing that I learned from you, like you told me, prior to you becoming or getting accepted into medical school, you had other previous courses you got involved with.
Yes.
Which course did you study before?
Yeah. So I was studying anesthesia. Sorry, I was studying anesthesia, infirmier on anesthesia.
Okay, that's
So
right.
it's a nurse
Yeah,
anesthetist. Let me just say
something.
it, because we are in a French country,
Yeah.
so it's hard to make this kind of translation. But
Mhm.
yeah, that was what I was doing. So I
So
did just 1 month of that, and I came back to Rabat to
where
study
did
medicine
you did it where?
at Ujda.
Ujda.
Yeah.
Okay. Let's see. How was it there in Ujda since you got that experience there for
So
1 year, right?
no, just for 3 months or
3 months.
2 months. Yeah.
Okay.
What happened was first year is always tough when it comes
Yeah.
to languages.
Language.
So when I went early on, I just have to learn English on YouTube and
Yeah.
come to class and sit the professors blab, and then I'll go home and learn on YouTube again. So
Yeah.
it was very tough. And to be honest with you, in Espit, you will hardly find people speaking French,
Yeah.
right? Your
Okay.
colleagues will be
Yeah.
speaking
I
the
got
region.
an experience
Yes.
there.
But when I came into the medical school, I realized that it's the
Yeah.
opposite.
It
Most of the
was.
people spoke
Mm.
French. So yeah, it was quite easy for me to adapt.
So I like ask this question both ways now. So while doing anesthesiology or you female anesthesiology,
Mhm.
uh, what was your most awkward
Mhm.
moment
Mhm.
in both medicine or in the hospital in general, right? The
Yes.
most awkward moment
Yes.
in both sides. While doing medicine or when you're doing your female anesthesia?
Yeah. I feel like you just want to,
No, we
to
just
get
try
something out of me either ways.
to.
So doing the anesthesia, infirmary anesthesia, I didn't go to the hospital for
Mhm.
because I was just in first year.
Mm,
So we're hoping to go to the hospital during our second semester first year, but I left before then.
okay.
But at the hospital year, yeah, I had awkward moments, right? So well, there was one moment where we were having, ward rounds.
Mm,
So there was a patient whom first of all, there was a patient whom I treated very well. I think I
mm.
treated very well. And then the patient was asked if he's actually feeling pain. And she said, yeah.
You ask the patient.
No, during the war rounds, the
Wrong. Okay,
professors
the
will ask,
professor will
yeah,
ask him. Yeah.
that, okay, this patient, did you treat him well? He had an accident. You have to give her the pain
That was
medication.
in your
Yeah,
urgence, right? In
yes, the
emergency. Okay.
emergency.
Yeah.
So what happened was that they asked the patient, and the patient said, I didn't give
Wow.
any medicine, and it was very awkward. And there was another one where there was a patient who came in, I think almost half of the day,
Mhm.
came in around 12 p.m. So the patient was there. The patient, they were still looking for the diagnosis.
Mm,
So they did all sorts of tests. But the way they presented the patient to me, they presented the patient to me as someone who has a very banal disease, right?
yeah.
So I also went ahead with that. Later on in the morning, when
Mm.
I started re-evaluating the patient, then I realized that the patient is having something different from what they told me.
Yeah.
But then it was too late. So
Yeah, I think for me too, I can relate to that. Most
yes,
time, like most of the professors they already
yes,
understand that
yes,
sometimes with the patient they give
yes.
different stories, and
Exactly.
then
Yeah, 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 yeah,
and
yeah.
then even you check the observation, sometimes there's
Yeah,
some
there's
slight
slides. Yeah,
understanding,
yeah,
yeah, of
yeah.
it.
Mm.
If the professor come, they say different thing, and then if you as
The
intern or
intent over
something, they
there,
tell
yeah,
you
it
something
gets awkward.
different.
In fact, in
Yeah.
front of a large number of people, like let's say 20, it's something very awkward. Yeah.
So okay, let's expand the question again.
Mm.
Right? What was that? Okay, the wildest myth
Mhm.
you've experienced or you heard from a patient
Mhm.
being at a hospital
All
or
right.
anybody in general, not even a patient. What a
Yeah.
myth about medicine.
Well, about medicine,
Mhm.
you know, I normally don't pay attention to the myth because the moment someone starts saying it, I know it's wrong. All
It's
right.
wrong. So you
Yeah.
just
Yeah. I just laugh and laugh and
yeah.
go on and laugh. So there's this woman who came in with, how do you call small bowel obstruction, right?
Mhm.
So the patient have been home, constipation, not going to toilet, and then only for me to examine my patient by just during the examination you have to take the dress off and
Yeah,
see
yeah.
the abdomen and see everything
Abdomen,
is in
yeah.
place. Only to find out that my patient's abdomen have been cut with small blades with
Oh,
some
so
kind of
that really
things on
wasn't
it.
start.
So I asked, oh, what was she trying to do? She said it was a form of medicine to make her, you know, go to toilet.
Wow.
Yeah. So, and this is a thing that you don't normally do. When you are having problems defecating for 3 days or 3 or more days, and then you can't flatulate,
Yeah,
right?
yeah.
Yeah.
Absolutely.
You should go see a doctor because it could be a small bowel obstruction
Yeah,
or yeah, it
yeah.
can be an
Okay.
obstruction. So you should go and see a doctor. You shouldn't use your own medication.
Patient.
So yeah.
Yeah,
And eventually she was diagnosed of that. There was a bowel
obstruction.
obstruction,
Okay.
a small bowel as well.
Okay. So at this moment, right, when you tell someone in your family that you are a doctor,
Mm.
and maybe anyone, even a friend,
Yes.
and how is the reaction like?
Okay.
To you?
Okay. I think let me take it from here. I recently went back to Ghana after
Mm,
7 years. So when I got to Ghana, I had to greet my family members and stuff like that. So you see me dressed like in a normal way, right?
mm,
Just simple because this is the lifestyle we live here mostly in Morocco. So when I went and my cousin,
mhm.
I went to my cousin's place. My cousin was telling the in-laws that I'm a
Yeah.
doctor,
Wow.
right? They
Yeah.
didn't believe it. So that was first reaction, right?
Mm.
Probably because the way I was dressed, because
Yeah.
you see me with my normal
Normal
t-shirt and yeah.
different.
So they didn't believe it
They
because they
expect you
expect
to
me
be
to
in a
be in
suit.
my tie, my
Your
suit,
tie.
yeah. That's hot weather, man. It's not happening.
Happening.
So I left.
You don't know you're the Lezami, the ordinary doctor. You're not doing all that.
I do, right? So I left. When I
Uh,
came back, my cousin was telling me one early morning when I came back to tell her that I'm leaving finally for Morocco. And then they were like, no, yesterday when you came and you left, I was telling my in-laws that you were a doctor. They never believed it. No, okay. So she asked me to wait so that the lady who never believed me to come out. So she asked the lady and the lady came out. The lady asked me, are you a doctor? And I said, yeah, I'm a doctor. And I asked, why were you doubting? So never said, but
Charlie,
I know
say
that Charlie, honestly,
she
it's
don't
because
trust
the way I dress.
that. Yeah,
Well, you shouldn't always judge a book by
for
its
the
cover.
color, yeah.
And then she went ahead to test me again. Can you imagine? She brought we in Ghana we call something weighing book. So it's the book that you can register the growth of a baby,
Okay,
yeah,
yeah,
those
yeah.
kind of
Wedding
things, the
book.
weight. So they were, arguing that a baby is supposed, because she said her baby, she's going to, no, my cousin's baby was still breastfeeding at a very grown age.
Wow.
And I asked my cousin, why is the baby still taking breast milk? And she said, normally she's supposed to stop at 1 year or 2 years. I'm like, no, it doesn't happen that way.
No.
6 months, it should be
Yeah,
over.
6 months should be over.
So they never believed me again
Oh.
until they went to bring the weighing book. And I read it to them that, look, minimum is 6 months. But
Yeah.
if you can go
up to a year
or two, it's up to you,
it's up to
because
you.
of course it's a good thing to breastfeed your baby with.
Yeah.
But at a certain age, these things are not necessary,
Yeah,
because
not
the
necessary.
intestines are grown and stuff like that. I don't want to get into details. So I was telling them, so they never believed. They brought the book and I read it to them, and then that's when they were totally convinced that I was a doctor.
I hope now they are still relating every time to you.
Yeah.
On the medical issues.
Yeah, exactly.
Okay.
So yeah, it's fun.
So have you had this experience where anyone that knows themselves right before you, like
yeah,
and just for impression, just to impress you, like trying to know.
Yeah. So there was one point in time, where I was at the emergency, the consultation room. So what happens at the emergency is that the consultation room is made of 3 beds. So people normally troop in. So you see people lying on the bed, you see people standing in front of you. So there was one patient who I was seeing. You could just actually see patient while standing, because you just want to know which one is the emergency and which one is not. So the patient was telling me about his problems. And out of nowhere, another man came and started speaking. Yeah, I think he's having diabetes type 1 because this, that. I'm like, no, it doesn't work that way. He's not speaking to you and stuff like that. So the fact that he was not even diagnosing himself, he was diagnosing someone in the presence of me. Meanwhile, he was also there to be diagnosed.
Yeah.
So you can imagine. So situation like this happened to me.
Back home, I had a similar situation like that where I used to when I get sick, I get to the hospital. I'll just go and tell the doctor, because I already know the same thing about me. I'll just go and tell the doctor.
Yeah, I have malaria.
Yeah, I have malaria. My legs, it's my legs. My body is out. In the evening, I get that symptom. So
it's
I know it's malaria.
Yeah.
That's the boy. Why are you here?
Yeah, exactly. So, yeah, it happens. It happens all the time.
Most time. So this body, like, what one thing that that people assume about African doctors? You think? One thing that people just assume about African probably doctors. You believe that it's not true, or
for me, I believe it's not true because
one assumption that it's not true.
They think African doctors don't actually diagnose very well.
Okay,
it happens in medicine. It's the case, but with certain machines, certain analysis, it helps diagnosis easy, and it helps us to know definitely that this is what might be wrong with the patient. So if people don't have this kind of things, because I had a conversation last time with someone and the person was trying to tell me that whenever he goes to the hospital, he has realized that most doctors, and I know he was talking about the African doctors, they just treat the patient. They give the person paracetamol and stuff like that. But he believed that you should treat the etiology.
Yeah.
And I was telling him that, look, we are in Africa. And I know you are speaking because you're in Africa and you are seeing African doctors doing this. We don't have the necessary things to just start with, to look for the etiology. Aside that, it's very expensive. You can't just come to the emergency with headache and I'll say go for CT scan. It's expensive.
It's very expensive.
So what would I do? I will ask you the questions, the necessary questions. And if I'm very sure that what you are presenting could be a cerebral accident, maybe ischemic or hemorrhagic, fine, I will consider doing the CT scan. But if it's a chronic pain,
Mhm.
or not even a chronic pain, something banal that you are not having any other
Yeah,
symptoms
no.
attached to it,
Mhm.
I can give you the paracetamol,
Yeah.
wait for 1 week, see how it would go.
Yeah.
Then if it's not going, then it's becoming chronic. That's when you look for etiology, because you
Yes.
realize that sometimes it's just a mere stress.
Stress.
You
Yeah.
didn't sleep very well, and I will not go through the length of doing just a CT scan for
Yeah.
that.
Yeah.
When
And
I know
it
you
become more
cannot afford it.
expensive on them.
Honestly, if you can
Yeah.
afford it, why
Yeah.
not?
Why
I
not?
can. And it's very important to know the history behind it, because I've had this on several occasions.
Yeah.
So probably you come with a headache, with your high blood pressure. Of course, I can do a CT scan because there can be a turn in an artery in your brain, which can lead to bleeding in the head. So yeah, those are some of the things we consider.
Yeah.
Yeah.
So
So it's not true that we only treat the symptoms.
the symptoms,
We
yeah.
treat it based on
the causes.
on the
that
causes, the other signs attached to it. Yeah.
And being an African doctor,
Mhm.
do you feel pressure, to be perfect only because of the title or because of what you
For me,
the title of a doctor? Are you so pressured about?
I'm not pressured to be perfect, because I know no one is perfect, and they
Yeah.
also say practice makes perfect.
Yeah,
So yeah,
practice maybe
that
you
means
have to. It's medicine. You have
it's
to keep
medicine.
making.
Yeah. We've been comparing ourselves. That's one thing that I've realized is not even in medicine.
Yes.
Comparison in medicine is very bad. All right. That's why even when you complete, they don't give you a particular score and stuff like that, because you end up demarcating the patients. All right. So it's all about attitude. I'm not pressured, and I believe it's something we shouldn't be, because when you are pressured, you do mistakes, you rush doing certain things you shouldn't do. The most important thing is you have to, be empathy as much as possible. You don't have to be pressured. Do what you're tackle what is really the emergency. You don't have to, rush into things anyhow, because you want to be perfect. You want to show to everybody that like you are good at whatever you do. It's the patients at the end of the day we are all trying to
Yeah.
save. So the smallest thing that you bring on the board,
Yeah.
it's already enough. You don't have to prove to anybody. You are not proving to anybody that you are
Yeah.
really good. Just
Yeah. I
be
get that.
empathy. Yeah,
Yeah.
that's one
Yeah,
important thing.
that
Yeah.
actually matters a
Mm.
lot. So have you ever like felt, how should I say, felt more like the value? Have you ever appreciated the value of burning long hours? Like in a hospital,
Like,
the amount of hours we burn, or do it comes with so much expectation? And
mhm,
more to it,
mhm.
what do you use? Do you prefer coffee or tea while burning long hours at the hospital?
Okay. For me, I don't take cafe. If I take cafe, then I have no option. There was no tea. All right. Yeah,
Yeah,
then I'll go
I
for
take
cafe
coffee.
only.
Okay.
Yeah. For me, I don't like cafe. So how do I do with burnout? For me, I'm someone who loves to do, because I had a conversation once again with a American lady, and she was telling me that she has realized that most doctors do something aside medicine, and
Yeah,
it's a way of releasing stress.
that's true.
Right. For me, I do video editing. You should see me when I'm not at the hospital.
Yeah.
I sing, I do
You
karaoke,
do a
I
lot of things.
dance, yeah. So I watch
Yeah.
movies. I'm on Instagram almost all the time. So yeah, that's another way for me to, to distress, because I just love funny stuff and I laugh at it. And I think yeah, that's what works for me. Mm.
Okay. So, what one thing that medicine have taught you about people? Probably maybe you expect it or you didn't, but what one thing you have learned?
So one thing that medicine has taught me about people is growing up, I used to trust people because I had no bad intention against anybody. So I felt like everybody is also the same like me. Then, well, I grew up through secondary school and stuff like this. So my level of trusting people actually came down a little bit, but not up to the level of me getting into medicine and knowing people, because patients can lie.
Mhm.
So there was no way I could trust anybody in front of me. If as to to ask them if you are feeling pain here, if you've not, gone to the toilet for 5 days, I don't know what to trust.
Yeah.
That's one problem most doctors face, especially at the emergency, because the emergency is just straightforward. You are trying to eliminate what can kill the
What can
patient
keep
on
it?
point.
Yeah, another
Exactly.
point. Yeah.
So when you get there and the patient is lying,
It's giving another
history
history about what
about
happened.
what is happening,
Yeah.
you are not able to know what is really the
We can
emergency,
see. Yeah.
because the patient is lying. You are wasting time. You have to see other
Because you have to see
patients.
another
Others are
patient.
waiting. you can't know who is having the
See,
emergency
or who's
or who
not
is not
having
having the
this
emergency.
because the story is not
Yes,
relating.
and I don't know if there's a paper written on how to go about this trusting patients, but this is one thing medicine has taught me about people is trusting people. I can no longer do that to that level I
Yeah,
had
I
when I
understand.
was
Yeah.
very young. Yeah, I
Yeah.
can't.
So, to you now, Ray, what does success mean to you right now compared to when you started? You know?
Okay, if I want to say I'm successful, I would say it's the amount of things I know now.
Okay.
Yeah, that should,
Yeah.
but then that should not be the only way you can measure your success.
Yeah. Yeah.
Honestly,
Yeah.
for me, I think that's how I can measure it.
Yeah.
The things I know as
Yeah.
compared to when I started, it's enough for me to be say I'm successful. I don't have to get the money. I don't have to, yeah. I think the things I know when it comes to human body, what to do,
To
all
what to
this,
do,
yeah,
what not to do.
yeah, what not to do,
Yeah.
yeah. I
What
think
are some of those precautions you have to take as a
yeah,
person?
as a person, yeah,
Yeah. You
yeah,
know that.
that's alone is enough for me to
Know
say I'm
that I'm
successful
successful.
when it comes to medicine. Yeah.
Yeah. So, like, why you having a difficult day,
Hmm.
maybe at hospital or what? How do you recharge after maybe a crazy week or something?
All right. So for me, difficult day have been there for me. All right, I wouldn't lie,
Mm.
because I do other things aside, going to the hospital. So for me, what I would do is sleep. Honestly, I
Hmm.
would sleep, because
You're not video edit.
no, no, I will sleep.
Okay.
That's one thing I will do regardless. And you see me coming back from the hospital, and the moment I get home, eat my breakfast. That's like the next morning. Eat my
Mm.
breakfast, take my shower, I sleep. I wake up in the middle of the day again, eat and sleep again. So that's how I recharge. But there's one secret someone taught me, and I don't know it's a good idea.
Mm.
You take vitamin C and sleep, you wake up, you feel like nothing happened
Take
to you
vitamin C.
previously. Yeah. And it's medication just to, boost your energy.
Energy.
Yeah.
Yeah. Okay.
Yeah.
That's good. Me too.
Mm.
I'll keep that close to me.
Yeah.
Yeah. Okay.
Yeah.
So what should I say? What is one thing that you maybe think
Hmm.
or that you wish
Hmm.
really that your patient knew about you or just knew about maybe about doctors in general, you know? Hmm.
Yeah. I wish my patients know that I
No,
also
don't
have.
worry, your patient will watch.
Yeah.
I'll
Oh,
make
I
sure
don't care.
they won't know.
Yeah. I hope they knew I also have life aside medicine. I'm just like them, human being like them, okay?
Yeah.
Who can have fun, all right? Who can, do other things apart from just diagnosing them, listen to their story, also having my problems in the house, which can affect the way I work. But we do
Hmm.
our best not to, integrate it in our work. So they just have to understand it that way. That early in the morning when they come to the hospital and they say good morning to a doctor and the doctor frowns the face, you know that probably there was, misunderstanding between him and the wife or she and the husband in the house that could have led to that frowning of the face. Yeah, so it happens. It happens. So they should just understand that we are humans. So we
Yeah.
are not extraordinary. Yeah.
Yeah,
I
thank you
wish they knew
so
that.
much. I've learned a lot, and I think the audience also have learned
Yeah, I
so
know
many things
I learned a lot of camaraderie.
about the doctor.
I know.
So, and you
Uh-huh.
know, before we get to your parting comments, we need to do some little things.
All
So
right.
I will just try to get your reaction
Okay.
into some things.
Okay.
So sleep or coffee.
I prefer sleep, honestly. Oh, I prefer sleep.
So what? Okay, in the surgery room,
Hmm.
or in let's say in the operation room,
Hmm.
what song are you happy into?
What song
Yeah,
would I? Uh,
happy.
yeah,
Huh.
yeah. For song,
Yeah,
I think I would love a cool country music to start with,
yeah, okay.
and then move through Afrobeat because I love Afro. Except if the people my team will be working with, because it happens to be a team thing. If
Mm.
they are interested in it, yeah, we all listen. But we definitely listen to everyone's song. But there will be no way I would work without Afrobeat. Yeah.
So immediately after our shift, what the first thing are you doing?
The first thing I do is prepare a tea. Just prepare the
The
tea,
tea.
go and bath, and come and take my tea and sleep.
Yeah.
Yeah, that's what I
So
do.
so okay, a suit or a scrub?
Scrap any day.
Scrub
I feel
any day.
comfortable.
Okay. Okay. I don't know. What's the name of that other medical science the prof use? I want to ask you that
Hmm.
to Crocs. What are you taking? Do you know the
The sandals.
yeah, the sandals the
The
profs
the
use.
prof shoes. I don't know
Yeah,
its
like
name, but
yeah, it
it's
just
heavy.
yeah, it's
Yeah.
actually heavy.
Yeah, I think I
Yeah,
prefer Crocs.
you prefer
Crocs is
Crocs.
something I even
Probably
wear.
when you turn to a professor, you will like that because most of the
No,
professors love that.
I've realized it too.
Yeah,
Probably during their generation, that was what was there, so they
yeah,
also fell in love with it.
yeah.
But I think I prefer Crocs more.
So, name one country that you really want to like work in, love to work with. Maybe.
Choosing a country I want to work with, probably someone will say I should go for where there will be more things to work with,
Yeah,
right? When it comes to machines and stuff like that, because they facilitate the work, all right.
yeah,
But I would like to work with people who don't have the means, so
yeah.
we can help them in a small way. So I would love to work. I can't give a country because that way I will be saying that country is poor and stuff like that. So I
Yeah.
don't want to do that. So I would probably
No, maybe work in not only particular about medicine. Maybe you could work with video or whatsoever.
not medicine. Work
Yeah,
in like
work
like
in.
working,
Yeah,
wake up and
yeah, and just work in not
oh my
particular
days.
medicine, video
My
or
days.
whatsoever.
My days. Well,
Maybe
honestly,
maybe one of my audience might make your dream come true.
honestly, honestly, I would love to, get more knowledge. Oh, but it's a very tough question. I would love to honestly, I would love to work in Europe. Yeah, because they have all the Wi-Fi, the
Yeah.
facility stuff to make your life easier.
We go pray for you, Charles.
Yeah, yeah, yeah.
Yeah, we go pray for you.
But at the end of the day, I'll bring whatever I've learned
Yeah,
back to my
yeah.
country.
So
Yeah.
so what's the biggest stereotype about doctors in Ghana?
Doctors in Ghana. Okay. Well, I don't know if it's good or bad. They claim they know everything. Like they see,
That's
if you
the
see doctor,
that,
they know
everything.
everything.
That's the biggest. Yeah,
Yes,
it's not one
they
in
know
Ghana, I
anything
guess.
that has to do with the heart, the
Yeah.
kidney, the stomach, the brain, the liver, which is not the case. Come
Yes,
on.
yeah.
People are specialized for all this
All
kind of
those
thing.
kind of things.
Yeah, we can't be sitting and be eating,
Yeah.
and then you tell me, okay, I think my heart is beating
It's
so
so
fast,
fast.
and so you should take it. Where I'm a psychologist.
Yeah.
Everybody has
Different. The
different
funny thing,
specialties.
and
Yeah.
then somebody just called me. They asked me a question about. They said a lady, not to. They said the lady not to drink something, and then I was like, was it a soda or something? Yeah, they said a lady not to. No, energy drink. Like
Ladies are not
to,
supposed to
to drink
drink.
energy drink.
Only men are
And
supposed
yeah,
to.
and then it was just asked me the only like men should drink energy drink. I'm like what? I say in general, energy drink are not good for all genders. I understand,
Do you know one thing I've
but
realized?
because of the caffeine thing. But you wanna just say only for ladies? But okay.
Mm.
So who told you, doctor? I said, okay, that's what the doctor say.
Yeah, you
I'm
have
not.
to. You are not a doctor
I'm
yet.
not a doctor yet.
Yeah, I get it. You know what I've realized too as well? The important thing, they do search because they search to look for it. For instance, someone starts having pain, right, in the abdomen.
Yeah.
Says, okay, I think the pain is here. I think it's appendicitis.
Yeah.
He goes online to confirm. They don't. Do you know what they do? They confirm what appendicitis is,
Yeah.
and then they get the results. Then they come to the hospital and describe whatever they saw on the internet. But the weird stuff, they don't. Things that worries their brain,
Right.
they don't search like
Yeah.
you are saying.
Yeah.
Like, is it true that energy drink is for only
For
men?
Oh,
You have to something like this. You should search, but they
Yeah.
wouldn't.
Yeah.
But if they are convinced that okay, someone had this kind of pain, they went to the hospital, it was appendicitis, that they put it inside.
Yeah.
How does appendicitis look like?
Yeah.
Which is really bad.
Yeah, like you said, medicine. It will always be like that. There will
Yes,
always be different opinion
unfortunately,
about it.
unfortunately,
We always have different stereotypes, like what you said
Yeah,
about Ghana.
yeah,
Similar thing.
yeah.
People say similar thing back home.
in
So,
Liberia too.
yeah, people say
Yeah,
similar things.
yeah.
So
So
yeah, because
is.
back home, like most
Then
of
it's
my
an African thing.
yeah, most of my teachers like biology, chemistry
Yes.
teachers, were all medical students.
Yeah,
So when
yeah.
you are coming, like hey,
Oh,
yeah,
I
so
see.
we used to feel like, and they were
Of course,
they
in
were
Ghana
all
too,
to
they
that
say,
level.
they know
They're so
everything.
extraordinary.
Yeah, they're extraordinary.
Yeah.
No wonder someone thought I was not a doctor. They
That-
never believed me. Yeah,
yeah.
because they expected me to, walk in the air. Fortunately,
Yeah,
no.
so thank you so much. It was actually glad.
It's always a
awesome
pleasure.
to have you. Should we have a game to play?
Yeah, I feel like we should have a
We'll
game.
We'll have a game.
Yeah.
So
Let's talk about
we'll have a game.
medicine.
Mhm.
Now that is a medicine kind of video.
Yeah.
So is the question,
Should be medicine related.
yeah, medicine related. So you should go first. This is your channel. I brought the idea.
Well, you have a game idea. You have a game idea.
It's the questioning.
Yeah, the
Yeah,
questioning.
yeah. So the idea should be centered on medicine, and you should start the question first. And you should, but not if I know you are taking longer time, we just have to end the game because you lose
Yeah.
then.
To get a game, to get a game.
All right.
A medical game.
Mm-hmm.
Wow.
Yes.
I don't want us to do quizzing because that's the only thing my mind
All
will
right.
go on.
Hmm.
Let me see. I've already asked you one of the weirdest things that you can say about medicine to
Yeah.
me.
Okay.
A game.
Is it true that medicine takes a very long time to study?
Yes, it's true.
You are wrong.
Yes.
You're supposed to ask me a question.
Oh yes. Okay. Okay. I'll go again. I'll go with that again.
Okay.
Okay.
Okay. I should go again.
Yeah.
I should go
Okay.
again. Okay. Is it true that doctors know a lot when it comes to medicine?
Isn't that true?
Have you ever heard of that?
I think you know about it, right?
Was it not what we were told?
Who told you that?
I heard people saying doctors take a lot of money. Is that right?
Money from where?
From the government, isn't it?
Are there only one government that pays everyone that amount of money?
Is it not 5,000 Ghana cedis?
5,000 is too little, right?
Why would I look for more?
Because you need more to take care of your family at all time, right?
How much can a family of three eat?
I guess they need your medication all the time also, right?
Why are you saying too much, right?
Because I
I
got this. Oh man, I got this
You
stuff.
have to close it.
Alright, okay. So even though it's my own podcast, this is the impulse.
Yeah.
The guy came in warm me in the game.
Okay.
But
Thank
it's all
you
cool, it's all nice.
for acknowledging that.
Yeah, thank you so much for coming. This is
Hi,
your
it's always a
platform.
pleasure,
Yeah.
Sidiki.
This is
It's
your
always a
platform,
pleasure.
you know.
Anytime, just let me know. I'll hop on.
Yeah,
Mm.
every time you see the dot, yeah, he's the dream behind, that's the motivation behind all this dream. So I believe that, we get it again all the time with
All
him.
right,
So
all right.
thanks again. And
It's always
to
a
the
pleasure.
audience, the dad would like to say something.
All right, guys, do it to subscribe, and yeah, you should also follow me on Instagram. Follow him as well. Anything that has to do with medicine, anything that has to do with geography, yeah, anything that has to do with life outside medicine, I think I have it all.
Yeah,
And don't
so-
forget to leave a comment in the comment section. And if there is more to add to whatever I've said, just leave it in the comment section. And if I lied, you have to let the people know, because we don't want to lie to the people on the channel, and do it to like the video as well. Thank you very much, Ahmad. I would praise you. I know you're the channel owner will not do it, but thank you very much for being here all the time.
Thank you so much. At least you mentioned the DOP. So thanks to the team and everyone who always make sure that we have series all the time.
Okay.
This is the impulse.
Mhm.
We start conversation at every point in time.
Okay.
And make sure to subscribe,
Yeah.
like, comment, and share. Make it go viral. To
Let
the
it
people.
go
Let it
viral.
So until we see you again.
Bye
Bye-bye.
bye.